A very good evening to you and welcome to the show. This is Health Check. And of course, this is your medical live show. We talk about everything health and wellness. So today I will be sitting in for Grace Mutiso, and I'm very much excited because today we are going to be having a very interesting conversation, an issue that has affected millions and millions of people all over the world. I was checking the statistics today, and 45% of people globally are struggling with weight loss. So today I will be sitting in for Grace Mutiso, and what we'll be discussing is something that also we need to really get the proper approach when it comes to weight loss and eating disorders, because at the end of it all, we need professional help when it comes to these matters. So I will be joined by experts. We have Mika, and of course we have Lance, who will be diving deep into the conversation on this particular topic today. And of course, if you would love to check us out live, you will find us on YouTube, Facebook, Twitter. You can definitely get us there. It's Hope TV. You will get us there. And of course, you can let us know on any questions that you have regarding the topic of today. And our WhatsApp number is 0708 222 or also you can send in an SMS at 20933. Together, let's work at promoting a very healthy lifestyle. So, karibuni sana. How are you doing today?
Oh, fine.
Yeah, so maybe you can let us know on exactly what you do. Give us a brief introduction. I'll start with you, Dr. Lance.
So my name is Dr. Lance Mayabi. I'm a husband, father of 3 daughters, and a general laparoscopic surgeon based at the current hospital, where I head the surgical department and also as a program director for the COSEXA training program in general surgery. Yeah.
All right. And Mika?
My name is Mika Kibera. I'm a clinical nutritionist practicing in the country. And I have a passion for wellness and health, and I practice it on a day-to-day basis. Yeah.
All right. So let's get into the conversation of today, because I think when we talk about the topic being overweight, some people don't really get it. But when I was trying to look at, okay, what really determines that you're overweight, I would see that depending on your age, depending on maybe your size, your height. So there are so many things and there's so many questions around it. But how can we truly determine clinically that someone is overweight? Maybe we can start with you.
In the clinical setup, we start by screening using a tool called BMI, body mass index. Then after that screening, that's when we dive in a bit deep and do something called body composition assessment. So BMI is an assessment of your weight against your height. Think of it this way: your body is like a bookshelf, and the more space you have, the more you have space to pack in your books, and the less space you have, the less space you have to pack in your books, which means you'll have to squeeze in some more and distorting the shape of the bookshelf itself. Now, when we dive into body composition, that's when we look at the values, the weight values you are presenting. How much muscle, how much bone weight or mineral weight you're having, protein weight. Also, we look at your fat mass, and also we look at your water weight or water levels. And this when we use it, we break it down and we come up with a wholesome or a 3D image of your weight.
Wow, it's more complicated than I thought.
Yeah.
But okay. So, Dr. Lance, having dealt with even people coming in for surgery and whatnot, especially when it comes to matters weight, what would you say is the importance of weight management?
So looking from the medical perspective, many people who come to see us actually have issues with losing weight, or they say that they're overweight. So the thing that actually brings them in is either most people have a life-changing event, either to them or their loved ones or someone who's close to them. So you'll find like maybe someone was recently diagnosed with things like diabetes or high blood pressure, amongst other conditions, infertility caused by things like polycystic ovarian syndrome. So when they come to seek help from us, one thing is we want to reverse some of the chronic health conditions that they have, in particular high blood pressure, joint issues like arthritis because of the weight, back pains, and and all those, high blood pressure, which also is a factor of weight, in something that we call metabolic syndrome. You can also have infertility issues, because many ladies who actually who are obese have infertility issues. They tend to present with something called polycystic ovarian syndrome. Other people actually just come because of body image issues. So they isolate themselves. The society, they don't feel acceptable within the society, and this causes things like depression and all. Others, it's because they have conditions where they either eat when they are stressed, and they want to stop that, or they want a quick fix. The people just come because they want a quick fix. But in terms of the importance of weight management, the main thing is just control chronic, the various chronic diseases that might arise later in future, or they already have, and even sometimes like some cancers which they may present with in the future based on that.
Okay.
Yeah.
All right. And I think while you're at it, we can talk a little bit about, the societal pressures. Because again, with the social media era, you find that a lot of influence is there. And we almost have an SI unit of how a woman or a man should look like. Because if they're being used for shows or music videos or whatnot. So do you think that social media in itself has played a huge part in how people maybe view themselves? Maybe you can just add on to that.
I think that is true. Social media and I'll say just a society currently, how they perceive someone who looks healthy, this slender, beautiful, flowing hair, young lady, who's full of life and energy. So that's the main thing. The other thing is just because of peer pressure. You find especially when in young people, where someone seems to get more attention than you, and probably it's perception because of their weight, and sometimes people even get bullied for the same. The converse is also sometimes in society where you find people accept you being bigger, and that's unhealthy. So it can go on both sides of the coin, where when you tell someone that they're overweight, they say that's fat shaming. They say plus size and all that. Yet we know that it's a problem. So it can be on both sides of the coin if you look at it. So there's a lot of media influence and societal influences depending on what the person presenting to you is on either side of the spectrum.
Oh, okay. And let's go a bit to the side of eating disorders, because I think some people don't take it seriously, like kwa wengine ni kawaida tu, the whole eating disorders. But I think it's an important thing to really discuss. And as much as some people see it as normal or maybe see issue kubwa, how then do we truly determine that this person has an eating disorder? Maybe you can let us in on that, Mika.
So our relationship with food can also directly be compared to the happiness we experience. Because I walked into one restaurant and I read on the wall it was written, "Food is happiness made edible," and it was very interesting. Which means everyone who's eating is experiencing some euphoria from the action. So yeah. When someone has an eating disorder, they sometimes exhibit some behavioral traits that might seem as though they are self-isolating. For example, someone can disappear during meal times. Every time there's a food on the table, they disappear. And when the meal is over, they reappear. Or they do not want to eat next to people, close to people, or with people. Those are some of the telltale behavioral traits you can see from afar. Or whenever someone eats, they feel guilty. You'll look at them and you'll feel, you see, the face of happiness, someone smiling and so forth. To them, it's like they're self-blaming. Why am I eating? Why am I putting all this in my body? It's going to do 1, 2, 3. It will distort my appearance and so forth. And there's also the physical presentation health-wise, whereby you look skinny, malnourished, and you actually look weak and emaciated. So those are some of the things you can look out for if when trying to identify someone who might be trying to manage their own eating disorder.
Oh, wow. Okay. And I think even thinking about that, then that means that relatives ama watu ambao labda ni wazazi of this person who is experiencing such things, how best can they help such a person who is expressing such behavior?
Human beings are social. We are meant to live in societies. There's something called blue zones, whereby they were assessing individuals who lived for a decade plus, like they lived for 100 years and so forth. And one thing they realized was social interactions was key.
Okay.
It keeps us sane, or it keeps us involved. So when it gets to a mealtime and you isolate someone, they feel as though they are not part of the family. But when it gets to a mealtime and you insist everyone has to be at the table, we need to have this meal together, make it a social event.
Okay.
Talk, interact. That's the time you have to even learn about the person's day. It becomes an experience someone can look forward to. So that's one thing you can do to bring them closer and actually also foster a positive environment for them to actually open up and see that food is not an enemy. It's actually a tool for health, and it can also build up on their positive outlook of the same.
Yeah.
Yeah.
And I think if we can get anything from movies, we always see them doing that.
True.
Most of the time.
Yeah.
Maybe Dr. Lance, you can let us in on some of the most common eating disorders.
So eating disorders, I'll tend to put it in two ways. So there are eating disorders that might lead you to weight loss, and the eating disorders that will lead you to weight gain.
Okay.
So the ones that lead you to weight loss are like anorexia nervosa, where you try and avoid any other avoidant spectrum of food. So you can either avoid a certain food or just avoid food, or you feel quite depressed or nervous when you're eating food. Then you have now like bulimia, where you eat a lot, you feel very guilty, then you want to purge yourself. So you try to make yourself vomit, you get laxatives so that you diarrhea or make yourself vomit, or you over-exercise, or just go into a very almost starvation just to try and compensate. Now that's usually that. Now when it comes to the ones that affect weight gain, now there's the binge eating disorder, where you eat a lot, you feel out of control, and you tend to feel full, so full, and then when you start feeling bad about it. The only difference is you don't purge yourself or do something that will cause you to expel what you've eaten. And the second thing is night eating syndrome. There are people who wake up at night to eat.
Oh, that's a condition.
Yes, it's a condition. So there are people who wake up at night to eat. So you'll actually find that either they have sleeping disorders. So they wake up at night, and the only thing they need not to do when they wake up at night is to go and eat. The problem is, and I think Mika can echo that, you have something what is called the circadian rhythm. At that point, you're having what a hormone called cortisol. When you're eating at night, you tend to now store more of that, of whatever you're eating at that point. The last one is also just a spectrum or a subset of bulimia nervosa, where you binge eat, feel guilty about it, but you don't cause yourself to vomit as the other spectrum of bulimia, or don't go into overexercise. So yes, you might want to purge yourself, but it's not as much as the traditional bulimia. So those are the two sides of it.
Okay. And maybe while you're at it, you can let us in on what causes these eating disorders.
Okay. So one thing is the genetics. So sometimes it could be hereditary. So if you had a parent or a relative who had a disorder, then you can actually inherit it. Secondly, you could be having some condition that actually cause you to have an eating disorder. One, psychosocial issues, either you are depressed, so people who eat when they're stressed, so stressful eaters, that's one. The other thing that can cause that is some medication. So, for example, if you're treating someone for depression or any psychiatric disorder like schizophrenia, bipolar disorder, amongst that, some of the drugs that they take actually make them eat a lot. Then there are symptoms like Prader-Willi. There's a syndrome called Prader-Willi syndrome that makes you actually feel hungry all the time. So you tend to eat. The people who are just born that way. So you tend to eat a lot, and you can actually gain weight. So basically that's it. And then the last thing is just societal norms. So like there's some societies which appearing overweight. Like I'll give an example. In African societies, if you're slim and you're married, they'll tell you, kwani your bibi yako akupiki ama mnapigana, or someone has to lose weight. And that's the biggest challenge you actually have for many clients, because when they start to lose weight, the society deems that that either they are sick, that is one, or two, that there's something going on between either in their relationship or something that's happening within their life, and that's why some of the things that actually affect weight gain and actually weight loss.
Oh,
Yeah.
okay. And maybe Mika, you can let us in on some of the myths and misconceptions around eating disorders, if there are any.
So the one most common one is that eating disorders are mostly for the Caucasian populace, but it also happens back here. It might not be as voluminous or as pronounced, but it is happening.
Right.
And it's fast spreading, because it's spreading and it's being adopted wider and wider and wider. And another thing is, some people think that some people might be of the notion that bulimia and anorexia are the only two types of eating disorders that are there. But as you've heard, there is the night eating syndrome. There's the fad dieting, whereby you eat what is in fashion. Yeah, there is the Doc talked about binge eating.
Yeah.
And it's very popular right now, especially with the screens that we have in our houses. So someone has the notion to just snack and sit in front of the screen. And as you're binge eating, you're binge watching. So you finish a series in a very short period of time.
Yeah.
So that's another thing. Then the other notion is that it's being isolated. It's not being recognized as a medical condition, but it is. It's both medical and psychological, and it's something that needs to be addressed in the same confines or in the same environment. So medically and also psychological. This is an individual who needs to be assisted, who needs to be guided, and who needs to be held their hand until whatever they are facing, they can be able to channel through it. Yeah.
Yeah, and I think as you were talking, I was reminded of when you check TikTok, there's this videos, people record themselves eating, and they're just eating chicken, and everything is just. You even wonder what's
Just to add
going.
what
Yes,
Mika
sure.
said, I think
Yeah.
some other misconceptions we have is like the way someone appears does not tell if they're having an eating disorder. Actually, someone can look healthy, but they actually have an eating disorder.
Right.
The other thing is people think that it only happens in younger people. It can happen in all ages, all genders, and all. And sometimes when people think that you can actually snap out of it, and also you cannot relapse once you're out of it. You can actually not snap of it. That's why you need professional help with that when you're having an eating disorder. And yes, even if you got help, you can actually relapse back to it, because could be either be having a stressful condition or event happening and makes you go back to your disorder that was there before. Yeah.
Okay, say someone watching today is asking themselves, how does the treatment of an eating disorder happen? Of course, I understand it has to be specifically tailored to the different conditions, but what are some of the basic ways in which eating disorders are treated?
First of all is to check if there's any underlying medical condition. Is it a syndrome?
Okay.
That can cause, are they on any medication that could be causing them to eat more? Because there's some that can actually cause that, like the cannabinoids and amongst other things. The second thing is to use what is called psychotherapy. So you can either you do what is cognitive behavioral therapy, where you try to work on the emotions, their feeling of low self-esteem, body image issues. So you improve their thinking of their body image. That can help. The third thing is actually to rope in their societal support. So bring in their family Like Mika was saying, we prefer to eat around the table, so it's easier to be able to bring and make them not feel too bad by what they have been doing before. And most important is, even as you try to change their behavior, the most important is their follow-up.
Yeah.
Because sometimes they do change, but like I said before, you can have relapses. So you have to find out, is there a continuum
Right.
of care to see that they're actually maintaining their, or be dissuading them from the behavior that they had before.
Oh, okay, okay. And I think now it's very much important for us to talk about weight loss because, again, at the end of it all, there are so many people who are struggling to lose weight. But maybe, Mika, you can let us in on what are those healthy and unhealthy ways of weight loss management?
So I'll start with the unhealthy weight
Okay.
loss. So if you lose a lot of weight within a short period of time,
Yeah.
and then we conduct something like a functional assessment. You used to go up 5 flights of stairs, now you can't. Then also doc will collaborate on the recurrent infections. You find that your process of weight loss is actually a negative, is having negative effects on your wholesome health. Then that is not positive weight loss. Two, when we assess you and we find you're losing mostly muscle mass, then that's not a healthy weight loss. That's actually malnutrition presenting itself.
Right.
That's malnourishment because you're breaking down the highest consumer of energy in your body. Now, on the other side is the positive weight loss, whereby we need to also appreciate the non-scale values or the non-scale victories, whereby you step on the scale, it doesn't change, but your clothes sizes are just reducing. You have improved energy levels. You feel bright. You wake up in the morning, you feel livelier. You wake up from sleep because you are not night eating and you feel well rested. And it has a lot of positivity that comes with it. Then that's positive or the correct way to lose weight.
Okay.
Yeah.
And maybe looking at the medical side of it, because I think we all have different ways of weight loss. Some go for dieting, some may go for exercises, the runs and whatnot. But are there any medical conditions that may almost determine the kind of weight loss, procedure you decide to take up?
So when a client comes to me and Dr. Mayabi, we first of all sit them down and take them through a counseling session.
Okay.
We don't just embark on the procedure immediately. Then during that counseling session, we're encouraging them to open up to us so that we can be able to understand how best can we be of assistance to them in this journey.
Yeah.
So yes, there are very many procedures and very many protocols to assist with weight loss out there. And there's a way to determine which one is best suited for an individual by first of all understanding them. If you look, for example, if someone is in the catering industry, always being exposed to food, and then you're forcing them to fast.
The intermittent fasting.
Yeah, imagine the amount of discipline this person must be practicing on a day-to-day basis.
Yeah.
Or someone is morbidly obese, in the class 3, 40 BMI and above, a BMI of 40 and above, and then you're trying to make them lose a lot of weight within a short period of time without having the long-term conversation, having the long-term goal conversation, explaining to them the step-by-step process that it will take, and also helping them decide the best procedure. Because some of them might need to go through the surgical route, which Dr. Mayabi is well versed in.
Yeah.
And after the surgical, they come back to me and we plan on the permanent way forward by establishing a positive relationship with the athlete. Yeah.
Okay. And maybe before we get to the surgery bit of it, maybe Mayabi, you can let us in on the whole perspective of, you've mentioned that my weight loss journey may not be the same as another person's. So how do people respond when you decide to tell them that this may not work for you, but this may work for you? Like, just generally, do people respond well to maybe something that they were not thinking of in advance?
So I think many times when I have a consult is people have already Googled or and found their information, and or a friend of theirs did something, or a celebrity that they follow has done this, and they say, no, I want this. Like, for example, we either put in a balloon or we do surgeries, and they come and say, no, doc, I'm doing this. So, but what I'll do, just echo Mika, is fine. You have gotten that, that's okay. But the first thing that we usually ask is, what is your goal? So what is your goal? That's where we start from. And once you get the goal, then the next thing is to find out, do you have any comorbidities? So we'll either take a history to find out that, and if we don't find that there's anything there, then do some certain tests to find out if there's anything. Majority of the time, we find people actually pre-diabetic. Sometimes they're already hypertensive and they never knew. So we actually start from there. Second thing, we find out if they have things like sleep apnea, meaning they stop breathing when they sleep at night. Are they snoring? So that helps us to gauge if we are going to do a surgical thing, are they a fit candidate or not? Sometimes they can come with a perception, but they don't know. But most important is not even their goal, but what is the long-term thing? So because sometimes we don't even talk about the procedure first, we actually talk about the nutrition bit, which makes up to 80% of it. Then we look at, are they having any activity? Because some people are not active at all. So they will take a lift even to first floor. They will park outside the supermarket. They'll take an Uber to a place where they could walk. So we usually say that at least you have to commit to be able to base your life around activities. We despise things like having water bottles next to you, having tea brought to you. Go to the dispenser and get your water. Get smartwatches so that they remind you that you've sat for too long, that you're up and about, all things like that. And one most important thing is actually sleep. So we found out what is their quality of sleep, not their duration of sleep. It's a quality of sleep. Because when you cover yourself, whether it is very cold or not, at some point you tend to uncover yourself at night. Have you ever asked yourself why? It's because at that point, when you're having your deep sleep, you actually tend to burn some calories at that point. So in our experience, you'll notice that there's some patients, some clients who you've done a procedure, they're exercising, they're eating well, but they just either plateau or they start gaining weight again. And actually find that their problem is just that they just have disturbed sleep. So you find people sleep with their phone next to them, or the last thing that they do is look at their phones. So their mind tends to stay awake for a longer time. So when we find that is happening, then we tend to just take them through a sleep, almost like advising them on how to get quality sleep. Because that affects weight gain and actually weight loss for us. So that's the main sequence that we go. Once we get to that end, then now we put in the options. So rather say for you, based on this, this, and that, we'll start with this first. Sometimes, which means you have to exercise, you have to start on a diet, lose this certain weight before we can do this. Or, for example, we can use a stopgap. Like put in a balloon, lose some kilos over a period of time. Once your functional status has improved, then now we can offer you a surgical intervention. And the last thing is actually just to let them know, even if you came with your mind made up, we'll have to tell you what are the short-term effects of what you want, and what are the long-term effects of what you want. Because some people look at, I've lost weight, but I personally say there's no permanent method. There's no silver bullet. All of them, you can still regain weight. It's just a matter of time. If you don't do the other things of good nutrition, activity, and quality sleep.
Okay, great. Wow. This conversation is very, very, very informative. But we'll be taking a very short break. But once we get back, we'll be diving deep into the surgical bit of it. And of course, this is somewhere when we get to, you will definitely have a lot of insights because, again, most people do not even believe in it. And some people don't even know the best way to go about it. So once we get back, we'll be having the conversation. So keep it Health Check. My name is Beatrice Watare, and today we are talking about eating disorders and weight management. See you shortly.
Just at the moment, many of those who believe in Jesus are feeling what I call the big squeeze. It feels like the militant forces in society that oppose the gospel have mobilized like never before. Hi, I'm Bernie Diamond, and welcome again to Fresh. Have you been feeling that too? And honestly, as we see governments enacting legislation to limit religious freedoms, as we see those militant forces of evil becoming more and more vocal, more aggressive in jamming, in shutting down the Christian voice, it can feel as though they're winning. There's this thing that rises up inside us that goes something like this. It shouldn't be this way. If God is the King of Kings, why isn't He doing something about this? Why do I feel so persecuted for my faith? Depending on where you live, perhaps there's nothing new in any of this. Or if, like me, you live in a place that's historically encouraged and accepted the Christian voice, maybe this rising tide of persecution comes as a shock, hence that feeling of the big squeeze. But it shouldn't come as any surprise at all. As Paul wrote to Timothy 2,000 years ago, everyone who wants to live showing true devotion to God in Christ Jesus will be persecuted. People who are evil and cheat others will become worse and worse. They will fool others, but they also are fooling themselves. Did you pick that? Everyone, no exceptions. If you're devoted to Christ, you will be persecuted. And that bit about things becoming worse and worse sure feels that way, doesn't it? But here's the good news. Those evil people, they're kidding themselves. Remember, your King is still on His throne. That's His word, fresh for you today. It's under pressure that coal is turned into diamonds, amen? So if you're feeling that big squeeze, I'd love to send you a free copy of our latest life application booklet. It's called The Grace Transformation. To request yours, stop by at christianityworks.com and you'll see that free offer right there towards the top of the homepage. Again, that's christianityworks.com.
Such an amazing conversation on eating disorders as well as weight management. So welcome back. I mean, this conversation is really good. And of course, I see some questions that you guys have already sent in. And first of all, maybe before we go to the surgery bit of it, maybe we can answer this question from one of our viewers asking, how can one lose weight while living with diabetes?
So I think it starts with me.
You can go.
So you know that there are different types of diabetes.
Yeah.
So let me zone in on type 2 because it's the one that is associated with lifestyle and also weight gain. So diabetes is a condition which simply can be defined as impaired glucose metabolism or glucose utility in the system. So whenever there's an excess, it's either going to be stored as fat or it's going to be pushed out through the system, the eliminatory system of the excretory system of the body. So it's possible. You need to get on a diet plan that works for you. So you need to sit with your nutritionist and work it out so that you can understand what are the leading contributors to your high glucose levels and how you can eliminate or manage them on your plate. I say elimination because if it is sugar, that one you just have to leave it.
Yeah.
If it's something like rice or maize meal, ugali, then you learn how to portion it out.
Right.
2, you have to establish a regiment of activity. It's a system of eating right and also moving right. I talk about activity because it summarizes everything you do in 24 hours. So how you walk, how you exercise, how you indulge with others, and so forth. Activities train your muscles to utilize the glucose you have consumed.
Okay.
As food. So if it's not being utilized, it's lying idle in your blood. So you have to move. you have to move right, you have to be intentional with it, and then also you have to rest adequately. After you exhaust your muscles, they need time to rest. Whenever you are laying down your head, you're going to sleep. So you are losing consciousness, and then you're going to go into a paralytic state so that you do not act out your dreams. And your sleep comes in phases. So there is the
Yeah.
first phase, the second phase, which is not so. Now you're getting into the deep sleep, and then the third phase and the fourth phase, whereby you're completely knocked out. And you keep repeating this cycle over and over through the night. The first two phases help you unload the day. The last two phases help you rest your body.
Okay.
So if your body is not well rested and you're waking up in the morning,
Mm-hmm.
you're waking up with sore muscles that haven't been repaired. So you won't be able to utilize the resources you're providing to your body. So eat right, move right, sleep right. Yeah.
Brilliant. Okay. Maybe we can go to the other question here. One is asking, how can I manage stress eating? What are some of the coping strategies? Maybe Dr. Lance, you can take that.
So stress is eating depends with what situation it is. Is it a family issue? Is it a work issue? So the first thing is to identify what the trigger is, and then first own it up and acknowledge that it causes that. Second thing is fine. You can be having stress eating, but what foods are you eating
Okay.
when you're stressful?
Oh.
I know sometimes we joke about it, but you can make eating fun and healthy by eating alternative foods. You can eat some fruits. I know Mika is better at that. Let me not delve into which types, but you can eat some fruits instead of probably eating junky or maybe crisps, biscuits, amongst other things. The other thing is, if it's a stressful time, can you take a break, do activity, walk around in that room, go out and meet people, do what you love to do. I know many people want to do things but don't want to do it. Is it being caused by peer pressure? And find out if that's the cause. Is it stressful eating because of things you've seen on your phone and all that? So the things, first identify the cause, acknowledge it, and then look for any other thing that can distract you from that. Or if you can't do that, then I think there are healthier ways of stressful eating at that point. Yeah.
Oh, okay. I also see another question here. This is specifically to Dr. Mayabi, and he says how to add healthy weight after being diagnosed with is it achalasia or
Achalasia.
achalasia, and went through a successful surgery. This is Kayu, all the way from Kikuyu. So yeah, how to add healthy weight.
So the thing is, I think in isolation, it depends where you're starting from. And I think as Mika had said, when you do your biometric assessment, you'll have to find out that what is lacking. I know anytime you do the nutritional assessment, you can either find whether it's your protein levels are low, what is your fat density, what is your bone density. With that, hopefully, if your nutrition is able to do that, then they're able to advise on what to, how many calories to put up of what food, and able to use that. They can also prescribe some supplements that can help improve your appetite, help improve your energy as you recover, improve your absorption of the food that you're digesting, and even repair of the same. The other thing, even exercising by itself actually stimulates your body to incorporate what you've been eating. So apart from a good nutrition, also as Mika said, be active. And I still insist on I think we're all on the same page about quality sleep. That also helps gain your weight back. It's both sides of the coin.
Oh.
Yeah.
Okay. So I think there's another last question here. Okay, one is talking about the whole when one how long will you continue dieting till to the point of starvation, or how long will you exercise? I think maybe they're just trying to get the whole perspective of the exercise and also the dieting, how much is too much exercise, how much is needed. And I think even while we are at it, there's a conversation we were having before we began on how you can balance both dieting and exercising. So maybe you can just answer that question with the whole idea of how do you exercise and how do you also join that up with dieting to get the best results?
So I'll start by asking, what indices of progress are you measuring yourself against? So if you're using a singular perspective, then you'll keep having a singular notion or a tunnel vision.
Right.
But if you have a wide perspective and you're seeing yourself from all angles, both physically, mentally, socially, and so forth, then it gives you a better understanding of the effects of the weight loss you are hoping to achieve. So if you find yourself practicing a diet and it's stressing you, it might not be the correct diet for you. Because number one, the best restaurant you can ever eat from is your kitchen. Is your kitchen.
Yeah.
So if it's not coming from your kitchen, something might affect the sustainability of it on the long run. That's why it's becoming frictionless and tedious. The sustainability question, because you have to find yourself getting out of your way to purchase or get access to specific things. Now, learn to use what is locally available to you. I always say the greengrocer at the outside your door should be stocking what you're using to manage your weight. Because come rain or sunshine, they'll always be outside your door.
Yeah.
They are dedicated that way. They are there to bring you your groceries all day, every day.
Yeah.
But if you find yourself importing your groceries from some destinations, sustainability becomes an issue.
Yes.
Now, to the exercise side, we talk about activity because exercise is more, let me say, intentional and isolated. Because you'll have to, when you say exercise, everyone is thinking about the gym. I have to go to the gym. I have to do hiking. I have to do 1, 2, 3. But when we say activity levels, it's like what Doc was mentioning. Taking the lift from the ground floor to the first floor. That's sacrificing your activity level.
Yeah.
Taking a cab from point A to point B when you could have walked, like walking from wherever we are, just across the road to Nairobi Hospital or any other facility close by, versus taking a border, which they are readily available. They're actually outside the gate. So you see, activity level now encompasses the functionality aspect of what you should be achieving, because it now assesses what is your weight loss contributing to your wholesome wellness. And that's why I said, if you're losing weight and you're not comfortable with it, and even your health is deteriorating, are you really losing weight, or are you introducing a new condition to your body, which is malnourishment? So for such an individual, I would really encourage them to sit down and plan based on what is sustainable and accessible around them.
Okay.
Yeah.
Wow. Thank you so much for that. And maybe we can now head over to the bariatric. I don't know if I'm saying that right. Bariatric surgery. And also, who is eligible for this surgery also?
So, in a nutshell, bariatric surgery is weight loss surgeries. Traditionally, I think maybe let me take a step back, because when I talk about surgery, people might think that's the only form of weight loss that we do.
Yeah.
Most of the time, actually, what we do is non-surgical, and then we do the surgical point.
Okay.
So the non-surgical is the most common, actually. So we usually use what is called a balloon. So we put a balloon either endoscopically, meaning we put a camera through your mouth into your stomach, fill it up with fluid, about 500, half a liter of fluid, and then remove a catheter. Or we introduced one, I think, 2 years now, almost 2.5 years now, in 2021, which is a pill form of balloon, which does not require any anesthesia. So you swallow that pill, we fill it up with fluid, remove the catheter, and stays in your stomach. So what that does, it makes you feel full all the time.
Okay.
Slows down emptying of your stomach. So your frequency of eating is reduced. And it tends to work on your mind, meaning if you eat more than something, there's a consequence. So you either feel too full, you either vomit, can get some cramping, and that actually works on you to work on your portions. As Miko was saying, portion control over time.
Okay.
So you notice that lasts depending on the type, the soluble one lasts for about 16 weeks, the other one lasts 6 to 8 months, and some up to 1 year. And with that, usually people lose on minimum about 10-15% of their starting weight. But now on the surgical point of view, the most common ones are two. Either bypass, can be either what the traditional bypass means that you reduce the size of the stomach and then bypass a part of your small intestine. So you have both restriction of food and also malabsorption because you're not absorbing food. And that actually usually is used to treat conditions like diabetes, where it's uncontrollable, some high blood pressure, amongst other conditions. So that is a drastic weight loss. You can actually lose up to half your weight in a very short time, in 6 months. But there's also, the only disadvantage of that is the long-term effects. Because of the malabsorption, you tend to have things like fatty stools, a lot of, you'll require lifelong supplements. And the problem is the supplements are not the common ones you get in the market, because you're going to get more than what is actually required for a normal person. So it tends to be a bit expensive in the long run. But there are some certain conditions that you do that, especially if you have like acid reflux and all that. That's when you use the bypass, especially the Roux-en-Y bypass. The second thing that you do, and which is now gaining traction, because there are two schools of thought.
Yeah.
Initially, the bypass was a mainstay, but slowly over time, because of the long-term effects, people are now moving to what is called a sleeve gastrectomy, meaning reducing the size of the stomach from a bean shape to a banana shape. So you take about 70 to 80% of your stomach out. So, but the advantage of that is no malabsorption. You still do the same route, but there's restriction. So you can't eat more than what. So in some studies, it's still comparable to the bypass. But in terms of reversing things like diabetes and sometimes hypertension, the bypass tends to be a bit superior to that. So that's how we choose it. And sometimes there's also something called a biliopancreatic diversion. So it's a big word, but it's almost, it's incorporating the sleeve gastrectomy and also just doing a bypass at the same time.
Okay.
So that's usually, especially for uncontrollable diabetes. So usually do that to reverse it. All of them can reverse type 2 diabetes. Doesn't mean that they can't, just that the extent of them is based on what a person can tolerate. So in a nutshell, what happens is sometimes for some clients, they're not able to tolerate surgery. Either they have breathing issues, their weight, they can't, to be honest, they can't fit on our surgical table. So you want them to that. And also you're worrying about things like clotting after surgery. So you sometimes start with the balloon first, improve their functional status, and then choose a surgical form. And sometimes you still can do what is called a sequential ballooning, meaning put a balloon, let them rest for 2 weeks to 1 month, put a second one. And sometimes if you follow them up to 1 year, it can be sometimes be comparable to someone who has done a surgical procedure. So depending. But in a nutshell, it's not all about the procedures that we do. The most important one is, as Mika said, don't want you to lose weight and become malnourished. So for us, definition of weight loss is actually losing unnecessary fat, but maintaining your protein and bone structure. Because what may most people who actually lose, so weight loss, just to echo what Mika was saying before, should be gradual and sustained, not a sudden drop in weight loss. So you want a gradual weight loss because that makes you actually fit into your structure, and you might not need any other procedures, like plastic procedures like body contouring that may be needed later, or even if it's needed, not as extensive as it will have been if you lost weight in a very short time. Yeah.
Oh, wow. Okay. So I think maybe we can look into more questions because we have people asking. I think this is a very interesting conversation. But someone is asking, what will the doctors advise about weight loss and fibroids? It's a vicious cycle. Fibroids fed by fat, but hormones from fibroids cause weight gain. So I think it's basically a question. This is someone from the UK who is asking, but they've not mentioned their name. So what will the doctors maybe advise on weight loss and fibroids? How is this related?
So, so there's something called polycystic ovarian syndrome. I'm not a gynecologist.
Okay.
Most of the time, what I know is that when you have increased weight, then you tend to have infertility issues and hormonal imbalances. Is there an effect? Most of the effect is felt is usually in infertility. When it comes to fibroid, depending, can it contribute to that? It's a yes and no, because there are people who have no weight issues but have fibroids. But it's known to have that fibroids actually grow because of hormonal influence. So probably the hormonal imbalances can actually cause them worsen. But the main thing actually just causes infertility. And many of our clients whom we have done, who came actually in infertility, people who have been infertile for almost 10 years, once they lose weight, even within 3 months, you find their periods coming back. Some even have gotten children after losing weight. So it tends to just be on hormonal imbalances that weight gain causes, because the fat around the stomach is converted to estrogen, and that excess fat is actually converted to progesterone, which slows down everything. So it becomes a vicious cycle. Makes you store more fat, but also slows down, makes you feel, your body think that it's in a pregnant state, but you're not.
Okay.
Yes.
All right. And there's another question here. I think still Dr. Mayabi will be the best to answer it. Someone is asking about capsule endoscopy, and this is someone at Karen Hospital. This is Muteti Munyao. Ask Dr. Mayabi about capsule endoscopy.
Okay. So capsule endoscopy is nothing to do with weight, but fine. So endoscopy, from the word itself, means endo means to look inside, scopy with a camera. So as from the word capsule means like your capsule, the capsule that you take as a tablet for medicine. So usually capsule endoscopy is usually used to look for conditions in the small intestine mostly, but can be used to assess the whole gastrointestinal system. So it's a capsule with either one of two things: a camera at one end that keeps taking photos, either can be 3 to 6 frames per second, depending. What happens is, before we take that, is that you have to take a laxative and purge out everything within the system. Come in starved, take in with a glass of water. So what happens is we follow it down put in a gadget that helps to track it down, and a receiver, almost the size of your mobile phone, that you walk around with the whole day. Most of the time we use it for people who have done an endoscopy to look at the stomach and the first part of the small intestine, or look into the colon, and you never found any symptom, any sign of anything. But either they present with what is called occult bleeding, meaning you find blood, either the blood can be seen in stool, or their stool is dark because they are bleeding. When you do a stool test, is what is called occult bleeding, meaning you can't see it with your eye, but it's seen either on a microscope or things like that. So you want to interrogate the small intestine and find if there's any other place that could be bleeding. The other thing that can have is another capsule that has cameras on either end. This one is usually used to assess people who cannot go under sedation, to do either colonoscopy. The colon in itself is unique because it has what are called folds. So if you have a front-facing camera, sometimes as you go into the folds, there are hills and valleys. You might miss something that was behind that valley. So you want a camera that sees both in front and both behind. So it can be used as a checkup. So the people who don't want to go under sedation for some reason, and they say, okay, I want a wellness checkup, probably to check my gastrointestinal system, then sometimes you can offer them the capsule endoscopy. And also for other conditions like Crohn's disease, amongst others, or malabsorption, then you want to do a capsule endoscopy to check if that is the cause. But most of the time we use for what is unseen bleeding, but then you don't know where it's coming from. That's when you usually do a capsule endoscopy.
All right. Sawa. And I think maybe as we conclude, time is far much spent. It's amazing how time flies. But you mentioned it in passing on the fad diets, and also, so let me ask it this way: the difference between those fad diets and the evidence-based weight loss strategies that people can employ, and basically what to avoid altogether.
So fad diet is practicing a system of eating whereby you indulge on what is considered fashionable at that particular point, which mostly points to the fast foods. I call them fast because it takes a very short period of time to prepare it.
Yeah.
And they are very tasty and delicious because of the flavorings and the additives which have been added with that particular purpose to make them tasty and savory. Now, on the other side, we have the evidence-based practices that point towards a positive change to your body. And still under that, we have some popular practices. And I'd like to caution anyone hoping to participate in any of them that whoever you're following on, maybe on YouTube, on any social media platform, they are showing you their own personalized journey. And some of them have teams behind them, helping them. So whatever you're seeing is the end product, not the struggle, not the instructions, not the evaluations, just the end product.
Yeah.
So it would be best for you to come in and get your process also. Get your own process, your own protocol, your own evaluation. Then from that, you're in a position to indulge in a sustainable way to do what we call weight management.
Okay.
Yeah.
All right.
And for me, I always say, you have the power of choice. Decide what you want to eat. I have the power of volume. I'll tell you how much of it you can have. So if you have a medical issue or a medical condition that predisposes you to unhealthy presentations when you indulge in something, definitely I'll put the volume at 0. But if you want to indulge in it and we want to manage your cravings, we come up with a pattern of exposing you to it that does not create dependency. Because also when you practice a lot of restriction, you're just saying whatever you're told don't do, you want to do it a bit more. You want to find out, why am I being told not to do it? So such approaches really help. And there are so many tools that we use.
Yeah.
And most of them start with understanding your client and understanding your patient. That sit down, that conversation, that indulgence paves way to a positive plan that will not only help you, and it will also be sustainable in the long run.
All right.
Yeah.
Wow. This has been interesting and very informative. Of course, each and every person who has been watching us has gotten to learn a thing or two, especially on weight management and also some of the eating disorders that sometimes we look at them and we think they're normal. It is really, really important to get professional help before you decide on your own weight loss plan. It's important to get some professional help. And maybe just as we wind up, maybe you can just mention where people can find you on social media so that if they need any expert advice, they can reach out.
So on social media, I operate under the handle on Instagram, Nutrition Ninja. I keep updating informative sections so that people can be in information is power. So you can indulge with me there, or you can find me in Kileleshwa, Suguta Road. You can reach out through Instagram and we can set up a session for you. And during the sit down, you'll be in a position to understand yourself a bit better.
All right. And Lance?
For me, I'm not a social media bum, but I think for me, I'm usually found on the
yeah.
I'm based at the current hospital.
Okay.
Yeah, I'm full time there. But I think I trend on their media pages on all of them.
Yeah.
And I think also on my own LinkedIn one. But he's encouraged me, I think, to go there and inform people about what we do.
Be surgical ninja, you never know.
Yeah.
But anyway, thank you so much, gentlemen, for giving me such an amazing, time here, because I think these are some of the topics that have affected so many people. I mean, we have 45% globally people that are struggling with this particular matter. So thank you so much for coming through and shedding light on these issues. And to the viewers, thank you so much for hanging out with us from 7:30 p.m. We've gotten to the end of it, and I do hope you have a nice evening. My name is Beatrice Watare.